But with the Martinez administration, if you were an interest group that supported Democrats, they didn't care what you were about. They didn't care that they don't care that you're New Mexican. It was, we're going to cut these folks off at the knees because it's to our political benefit. And frankly, you know, it's hard to speculate what's going on with the medical cannabis program, but that's certainly one explanation for why we've got an administration that is so restrictive, trying to strangle this program, trying to hurt patients, trying to hurt the nonprofit producers that are in this to help the patients. And, you know, it could be that, you know, there's something to it that she just doesn't believe in it. She's so used to prosecuting people for having a quarter ounce and sending them to jail that she doesn't understand that medical cannabis is therapeutic, it's needed, it's the law. That could be part of it, but it also could be part of it that she doesn't think that she needs to represent that part of New Mexico. And she's wrong about that. And this gentleman here, Gary King, is not that kind of politician. I've known Gary for about 8 or 10 years, and let me tell you, first of all, he's one of the smartest people in politics in New Mexico, and sometimes you wonder, he's so smart, maybe he should get out, but he's not out, and because he is dedicated to public service. A great guy, Gary King.
About that a little bit. I want to talk about it a little bit. I will say up front, I considered, and I've been working with Cisco McSorley, who was in the legislature with me for a long time in the House, and then he's been over in the Senate on a platform, basically on something on this, and Cisco, very knowledgeable, been talking to me about the medical marijuana issues particularly. And so I was going to have something for you tonight, and I thought, well, wait a second, that doesn't make any sense. I mean, here's part of the problem with the Martinez administration in the first place. You know, I don't really feel like it's appropriate for me to dictate to you what I think that our policy ought to be. I'd very much more like to hear from you what you think the policy ought to be, and let's figure out what we do that, as Jason said, is good for New Mexicans, and the best thing that we can do. So I talked to a lot of folks tonight already, but I'm very interested in your point of view. So let me go back to the macro part for just a little bit and tell you there are basically 3 issues that are the reasons. So I'm not a prude, and so I will tell you this is the part that you don't get to hear. I do believe that the war on drugs that started back in the Reagan era in America has been a dismal failure, and that once And let me tell you why I think it's been a failure for several reasons. One, it hasn't been very effective in doing what it is that we want to do, which is, for instance, encouraging young people to make wise choices. But also, one of the reasons that we don't have money to spend on schools in America, but in New Mexico, is because of the increase in budget for corrections. Because there was a time period in there where we put a lot of people in prison, and this. Some people may not know this so much about me, but when I was in private practice in Moriarty, I spent a lot of time defending young people, college students by and large, who got busted driving across New Mexico with a trunk full of marijuana. And so I've done a lot of defense work in cases like that. Unfortunately, where we were in New Mexico, people by and large weren't getting put in prison for that. But we know that there are other states, particularly where if you had amounts of marijuana for personal use, that would cause you to actually get a jail term or a prison term. And so I don't believe that for personal use amounts that we should have prison terms. So that people don't hear that part about that very much, but I think that there are better ways to deal with the issue. Now, medical marijuana, which I know is the big issue. My office, when the medical marijuana bill was going through the legislature, I think we probably stay fairly neutral on that. As the Attorney General, it's an interesting position for me to be in when we have something that violates federal law and we're trying to change what it does for state law. But frankly, my personal position is that means we need to change the federal law. We need to support the federal law. I think that's important. But I was in a really bad car accident a number of years ago, 20 years ago, and so I got a lot of significant prescription painkillers prescribed to me while I was doing that. My position is, if you're ill, if you have a problem, and your doctor thinks it's in your best interest to take OxyContin, the doctor and you should be able to decide to do that. And so it's really weird that you actually can do that for certain opioid painkillers, but you can't do that for marijuana. I mean, that's it's because of the way that our laws were set up on the federal level. So we have an opportunity now around the country. States have been allowed to pass medical marijuana laws where they basically say for certain specified illnesses, like in New Mexico, in cases where the doctor prescribes it, you should be able to have this. And so the only place that's a little nuance there for me is that as the Attorney General of New Mexico, we did oppose having the state be a dispensary because as the attorney for the state, I didn't want to encourage the state to be in violation of federal law. And so when they were working on, I'm sorry?
No, they would not have grown good medicine. It would have been a disaster. It would have been a horrible disaster.
It was an interesting part of the law.
Thank you very much.
When we worked on the regulations, and my office actually advised the health department on the original regulations, that was the only part where we said we think by regulation you can keep us from getting in hot water by basically saying even though the law allows the state to be a dispensary, that the state should not be a dispensary. And so that was our position on that. So I am hearing from Jason and from Cisco and from a variety of other people that the governor now is trying to change the regulations to the point where, for instance, veterans won't be able to get marijuana for PTSD even if their doctors decide that they should. I don't think that was the intent of the law when it was passed, and I think that's problematic for the governor to be trying to limit what's available under the law. So you would not find me doing that as governor. I certainly would want to make things work, and I believe that during my term as governor that you will see the federal government finally, because of pressure from the states and such, deal with that issue at the federal level and maybe move marijuana from Schedule 1. And I know there's been here's one where I've been kind of busy the last few months, but I know there's been some pressure to move marijuana from Schedule 1 to Schedule 3. Schedule 3. Is that done or not done? Or descheduled?
Well,
yeah.
marijuana is Schedule 3, pharmaceutical is Schedule 3.
Right. So that would make it easier for the states then to have their laws that would mesh and such. So that's generally my position.
Available to any patient whose doctor who believes that it'll be beneficial to that patient without a lot of unnecessary hoops and illegal fees. And we want the producer industry and personal growers to be regulated rationally so that patients can get cannabis, have access to sufficient quantities at affordable prices. Don't put in unnecessary regulations that just serve to jack the prices up to restrict supply and kill the program. Do you think you can help us with that?
Yes.
Yeah. And I think that's what we want to hear, right?
Let me say, actually, I will add this much. I know that early on in the program, and I think it's still a bit of an issue, that because of the licensing issues, that you're right, that New Mexicans who qualify under the law have not been able to get the sort of supply that they need at a reasonable price, like you said, and we should not be forcing New Mexicans to go out and look for illegal supplies of marijuana because they can't get sufficient supplies from licensed growers, distributors, that whole chain. So I think that it is important to look at that and make sure that we're, as the state, are not, and I think that that's part of the problem, that we as a state are not restricting that part of the system so much that people who qualify under the law don't have access.
Great. I think that's the right answer. Now, here's another really tough question. We need you to be the next governor. You can't do it alone, though. You need folks like us to dig deep, don't you? I mean, your opponent is really well funded. You're close enough that if we all get behind you, you can win this race, can't you, Gary?
Absolutely. No, we're in a striking range right now. I will tell you, the Republican Governors Association is a very mercenary organization, and they spent $700,000 last month running negative ads against me, and I guarantee you, if the governor is 20 points ahead, they would be in some other state spending their money. I mean, they're spending money here because they are afraid that Susana Martinez is going down, and they have spent a lot of money here already to do that. So yes, I agree.
Okay.